Shall I? Okay. Uh, Distinguished guests, speakers, and all the delegates. Uh, I am thankful to Dr. J.S. Bajaj for giving me an opportunity to present one of the important area of the medical education, that is about the CME. As part of this National Academy of Medical Science conference, there was a pre-conference symposium, that is NAMS-AIIMS Symposium on Sleep Medicine. Now we have learned many lessons from this symposium, and I am going to share some of these lessons through these two small presentation. Optimizing the effectiveness of the CME program, NAMSCON 2013 experience. I have been held by Dr. Neeraj Gupta. He is assistant professor in pediatrics. The research question was, does the education intervention on sleep medicine in the form of didactic lectures and presentation as a part of the symposium improves the knowledge of the medical fraternity? So with this, we frame the objective, that is to assess the improvement in the knowledge of the sleep medicine after an educational intervention in the form of sleep symposium. The study site was this conference. It was an international study. Duration was 9 hours on 25th. Inclusion criteria were all the delegates who were attending the symposium, and the exclusion criteria was all the faculty who were part of the symposium were excluded. No consent was obtained. It was a voluntary participation, and we have not obtained the ethical permission from the ethics committee. Baseline, we prepared a questionnaire which was pre-tested and pre-structured, which consists of the multiple choice question with a single response, and which was prepared by the experts who had given these presentations. And in all, there were 30 questions which were of good quality, having a good discriminatory and the difficulty index, which is useful for a general population of the physicians. So this was filled by the participant before the start of the study, and then we did the intervention in the form of these didactic lectures, which consist of all the presentation from the speakers. There is interactions with the audiovisual aids, and the objective of this symposium was outlined to the participants, and these were to assess the magnitude, or to know the magnitude of problems of the sleep and its association with various disorders, to interact with the multi-specialty biomedical scientist in elucidating the sleep disordered breathing, to find out the screening approach and test procedure for diagnosing sleep disorder and their associated clinical condition, rationalize and plan the management of obstructive sleep apnea, and the role of the sleep labs and comprehensive sleep labs which are coming up recently in India. Now this was the objective of the CME program. As another thing which was added as an intervention was that at the start of the symposium, it was declared that those students or the participants who will give the answer or who will ask the questions, and their utility of their questions will be assessed and they will be rewarded. Primary outcome of this study was improvement in the marks, and the secondary outcome was increase in the number of participants passing with the more than 50% marks. So statistical analysis was done in the form of descriptive frequencies, pair T test, McNemar's test, and p-value was calculated, and it was considered less than 0.5 as a significant. Result obtained was total of 103 participants, and they were assessed on 30 marks. Only 92 participants returned the questionnaire, that was 89% participation. 11% did not return the questionnaire and 89 returned. This before the intervention, the mean score was 11.76, median score was 12, and the range was 1 to 20 marks out of 30. This is a pie distribution of the same thing. This is a frequency distribution of the participant, and we can see that there is a distribution around the 12 marks, and this is a frequency distribution. Participants who passed as a part of the secondary outcome was 26% only. Now when we compared with the post assessment, the total number of participants were 103, but respondent had decreased to 61. So this is a distribution of the marks obtained post intervention, and we can say there is a marked improvement with a maximum of 57.5% having more than 50%. So this is a median comparison. So there is a marked improvement from 12 to 18.3 and a median from 12 to 18. The range from 120 has increased to 11 to 26. This is a box diagram showing the improvement in the mean score from here to here. So there was a significant increase in the marks obtained in the post-intervention question as compared to the pre-intervention, and this mean increase of the marks was 6.2 with 95% confidence interval, and this was significant. Secondary outcome, that from the 26%, it has increased to 91.8% of the improvement in the passing. So this is highly significant. Now this is a analysis that is among the group between 1 to 10 marks, 33.9% had the score of 1 to 10, whereas in the post-intervention none had the score less than 10. Whereas 16 to 20 marks, it increased from 30.5% to 57.4%, and there were 23% who also include more than 20, which were earlier none of them were able to achieve before this question. So this study shows that educational intervention definitely changes the knowledge of the students, and when it is intensifies, because as an adult one learns when the incentives are there, and when the incentive was offered to them that there is going to be a declaration of the best student who will ask the best question, so there was participation was increased among the students. So this study greatly shows that effect, that we can improve our CMEs with some of the innovations. So educational intervention in the form of sleep symposium has been successful in improving the knowledge of the medical fraternity in the sleep symposium. Thank you.